Good afternoon, ladies and gentlemen of the Bill and Melinda Gates Foundation. My name is Kristen Kilcollins, and I'm a public health nurse. I would like to thank you for taking the time to meet with me today to discuss the racial disparities and maternal mortality in the United States. As a public health nurse, I have seen firsthand the disparities between Black mothers and their white and Asian counterparts. The problem that we are facing is a disparity in mortality rates between the races. Black mothers are 243% more likely to die during or after childbirth. They have a lack of access to quality health care. From 2001 to 2005 in New York alone, Black mothers were 12 times more likely to die than their white counterparts. Black mothers are affected more in rural areas or in areas where they have to use hospitals that appear to provide lower quality of care. Some of the barriers they face are their socioeconomic status. There's racism, bias, and lack of social support, whether with their family, their communities, or their medical provider. If we look at the social ecological model and break it down, at the individual level, such factors are age, education, income, previous pregnancies, etc. Some things that help are education or knowledge base of the individual. Some that hinder are beliefs that they are being treated poorly based on their race. At the interpersonal level, which would be members within their immediate circle that influence the individual and their behavior. This could be having a good relationship with their medical provider, one that helps them and can answer questions or concerns that they may have about their pregnancy or prenatal care. What hinders is when they avoid medical care due to a preconceived notion that the medical system cannot or will not help them. This can be based off things that their family members or their friends have told them from their own experience. At the organizational level, what helps is providing access to medical insurance before pregnancy, during, and after childbirth, which will help to reduce any financial burden on the mother. What would hinder is any biases within the healthcare system that Black mothers experience, which can affect their quality of care. At the community level, which would be areas in which social relationships occur, what helps is providing access to better quality health care or working with advocacy groups within their community that will help to give them a better outcome for their pregnancies. What would hinder this would be living in areas within the community where there's very large evidence of social inequities. This could be poor housing, lack of nutritious foods, lack of access to health care, safe and clean drinking water that could affect both mother and child. At the policy level, what would help would be working with such groups such as the Centers for Disease Control or with the Department of Health and Human Services, teaming up and providing public health professionals with tools that can help them create programs to provide culturally competent care between provider and patient would absolutely help to make this issue less of an issue. What would hinder, however, is inadequate funding so that healthcare, for example, healthcare reductions for Medicaid for pregnant women that are of low socioeconomic status. This would limit them not only in their access, but it would also give them a harder time trying to get family planning and reproductive health care services to prevent any unwanted pregnancies farther down the road. So, some proposed interventions to help reduce maternal mortality would to be surveillance and assessment of risk factors during pregnancy, local delivery of maternal child care in terms of family planning and prenatal care, and simple clinical preventative measures such as taking blood pressures or dipping urines for protein to see if the mother is starting to get into preeclampsia, which is a huge concern in a pregnant woman. These tie in because they help to address maternal mortality by helping mothers access resources that they would not normally have access to. This also allows for care in a familiar setting within their community and will provide medical care and education to give them a better chance at having a safe, healthy pregnancy, delivery, and postpartum period. Now, to evaluate our interventions we'd like to put into place, we can do a qualitative study, which we could go and interview within the community, anyone that has had the screening, and they can give us feedback on what they feel we need to add. We can do a list of outcomes that are being evaluated. So, did our services work? What needs to be improved? Is there anything more that we should add? Was access okay? Are there still barriers that they are seeing that we are not seeing? This can be done in questionnaire form. We can do interviews. There's multiple things that can be done to help evaluate these programs. And lastly, to measure the impact of our intervention, we could utilize a before and after study. For example, at the beginning of the study, brand new study, we see 7,000 patients in a 6-week period. After those 6 weeks are up, they've had a chance to utilize care. We have word of mouth. We've been able to advertise what we're doing and really get the word out there. We can reevaluate and say, okay, we started with this number. Now we're up to 15,000 people that are utilizing our services. Some of the barriers that we are going to have to address is access to these services. One way we can help to do this is community health workers. These individuals, such as a public health nurse or other providers, can go into the community and work with these women and offer services at their homes, in small clinics, at schools, at churches, wherever they feel comfortable and have access to get to. We can provide culturally competent care by reducing racism and bias, and we can do this by educating and training our providers. We also will have possibly monetary barriers. How we can fix this is to work with outside groups such as the Center for Disease Control or the Department of Health and Human Services. We can apply for grants and work together to fund this partnership in order to help provide a better sense of care for these patients. So we need to address funding, providers, community health workers, any medical equipment or medications that we might need, access to clinics or hospitals within the communities, making up pamphlets and other educational materials for the women and their families. And we need to educate and train our providers for culturally competent, unbiased care, as well as partnership with outside organizations and within the community. If we do this, we will be able to conduct surveillance and assessment of risk factors before, during, and after pregnancy. We will be able to provide local care for women, whether family planning, prenatal, and postnatal care. And we can provide simple clinical preventative care services such as glucose testing or blood pressure taking. If these activities are met, we will be able to conduct this surveillance. We'll be able to utilize clinics and outreach programs as well as community-based health groups. We will be able to work with community health workers to provide the simple preventative care for women within the community. And we will be able to provide education on symptoms of preeclampsia and other pregnancy-related problems that require immediate attention from a medical provider. If those occur, we will be able to increase the availability of life-saving medical resources to women. We will be able to increase the awareness of pregnancy-related health problems that require immediate attention. We will be able to increase the utilization of clinics and other programs, as well as increase the access to family planning and reproductive health resources. If these occur, we can hopefully reduce the preventable maternal mortality rates at least by half. We can also increase the medical services amongst Black mothers within the community that would not have typically had access to some of these resources. And we can also decrease the number of unwanted pregnancies within the availability of family planning. I would like to thank you for your time and your consideration of becoming a partner with our cause. Thank you.